Legislations and subsidies. On December 12, 2016, the Minister of Health announced an updated drug strategy for Canada called Canadian Drugs and Substances Strategy. The CDSS guides the federal government's response to the following issues: 1. All substance abuse; 2. Opioid overdose crisis; and 3. Legalization and strict regulation of cannabis. The goal of the CDSS is to protect the health and safety of all Canadians by minimizing harms from substance use for individuals, families, and communities by 1. Encouraging government, civil society, and the Canadian justice, healthcare, and other social systems to address problematic substance use as a health and social issue. Supporting the use of modern, effective, and compassionate approaches to prevention, treatment, harm reduction, and enforcement, including addressing the root causes of problematic substance use. Reducing stigma associated with substance abuse. Encouraging the development of policies and programs designed to defend and promote the health, dignity, and human rights of people who use drugs. Subsidies. As per Health Canada 2018, provincial and territorial governments are responsible for the funding of drug addiction treatment in their respective regions. Although the Canadian government assists with some financial aid under the National Anti-Drug Strategy, it's still widespread to find addiction treatment centers with a waiting list of several weeks. Each province has a certain amount of drug rehabilitation centers. Some are private and other are government funded. Examples are drug rehab centers for professionals, outpatient treatment centers, medical detoxification, long-term drug treatments, regular detox, and drug replacement therapy. Reaching Home. Canada's homelessness strategy is a community-based program aimed at preventing and reducing homelessness across Canada. This program provides funding to urban, Indigenous, rural, and remote communities to help them address their local homelessness needs. Housing First involves moving people experiencing homelessness, particularly people experiencing chronic homelessness, rapidly from the street or emergency shelters into stable and long-term housing with supports. Coordinated access system, a process by which individuals and families who are experiencing homelessness or at risk of homelessness are directed to community-level access points where workers use an assessment tool to evaluate the individual or a family's depth of need, prioritize them for housing support services, and help them to match available housing-focused interventions. Homeless Individuals and Families Information System, or HIFIS. Supports client intake, program assignment and case management, assists with housing inventory and matching, and provides privacy and confidentiality controls to protect data. Homelessness in rural and remote areas. It continues to be a priority. In Budget 2016, this funding was doubled, and under Reaching Home, this funding level has been maintained.
As per Registered Nurses Association of Ontario 2015, the nursing considerations and assessment tool for clients engaging in substance abuse are as follows. Screen all clients to determine whether they use substances. Screening is a formal process of testing to identify clients that have potential risk for or diagnosis of substance abuse. Administering standardized instruments in different settings has shown to reduce substance use among clients, improve access to early intervention, thereby decreasing harms to clients.
For clients who use substances, use universal screening questions and or an appropriate screening tool to determine the level of support required. According to Health Canada 2002, it is recommended that the nurse ask the three universal questions to screen all clients for substance abuse. 1. Have you ever had any problems related to your use of alcohol or other drugs? 2. Has relative, friend, doctor, or other healthcare provider been concerned about your drinking or other drug use or suggested cutting it down? And third, have you ever said, no, I don't have an alcohol or drug problem, when around the same time you questioned yourself and felt, maybe I do have a problem? Conduct a comprehensive assessment with all clients who screen positive for substance abuse as appropriate based on the nurse's knowledge, skill, time, setting, and resources. Due to increased health risks, nurses must be aware of the potential infections from IV drug use or high-risk behavior. 1. Localized and systemic infections or abscess, cellulitis, HIV, hepatitis B, C, infective endocarditis, and osteomyelitis. Build collaborative relationships with clients through the use of motivational interviewing techniques to develop the plan of care. It is very important to build a collaborative relationship between client and healthcare provider to allow a therapeutic environment that fosters the client well-being and autonomy through the process of recovery. An example is a motivational interviewing, an evidence-based counseling approach that is client-centered, non-directive, and non-judgmental, which nurses and clients can use to build a collaborative and empathetic relationships. Motivational interviewing creates a deeper understanding of the client's situation, needs, and goals, and improves readiness and motivation towards change. Use brief intervention to collaborate with clients identified as at risk for or experiencing a substance use disorder. Brief intervention is a time-limited approach to identify individuals that are at risk for or experiencing substance abuse. It is an effective way in motivating clients to change and encourage those with more severe problems to consider referrals to specialized intervention crisis. Advocate for and support access to combined pharmacological and psychosocial interventions as appropriate and promote the appropriate use of combined interventions to improve well-being and health outcomes. Nurses should ensure the following pharmacotherapy options are considered in management planning. Second, clients have access to appropriate pharmacotherapy. And third, pharmacotherapy is administered safely. Engage youth and adolescents at risk for or experiencing a substance use disorder using family-based therapies until recovery as appropriate. The nurse's role in delivering family-based therapy are as follows. Number 1, counseling. Number 2, promotion of self-care activities. 3, developing strengths and resources. 4, providing supported therapy, education, and health teaching. And lastly, building resilience in youths and their families. Reassess the effectiveness of the plan of care until the client's goals are met. Ongoing evaluation must assess his or her progress in the treatment. This includes re-examining clients' goals and adherence to treatment plan and safety.
Local resources in the community.
South Riverdale Community Health Center, located in Queen Street East, a nonprofit multi-service organization that provides community outreach, social and primary health care that aims to improve people's lives who's facing any barriers. Moss Park Overdose Prevention Site, operated by South Riverdale Community Center, health service that prevent overdose and saves lives by advocating and addressing impacts of drug and looks out for health and well-being of people who use drugs. City-operated supervised injection site, operated by Toronto Public Health located within the city, provide hygienic and safe environment to inject pre-obtained drug under the supervision of a trained and qualified staff, which aims to reduce number of overdose and prevent diseases related to unsafe injection like HIV and Hep C. Moss Park Armory, Canadian Forces facility located in Queen Street East, a government-approved home shelter for homeless. 24-hour respite site, an allied shelter service that provides services like resting spaces, meals, and additional support programs to anyone experiencing homelessness. And Salvation Army Gateway, located in Jervis Street, a shelter for men 21 years and older, also provide addiction counseling.